Before sampling, ensure that you have the correct equipment for the tests you will perform. For multiple tests, consider the order of sample collection. Identify the patient. This generally requires asking a minimum of 2 questions, such as name, date of birth, and address. Consider warming the sample site to increase blood flow to the area. This may be useful when a large volume of blood is needed or when the puncture area is cold or circulation is poor. Ask the patient to warm their hands by rubbing them together or wash them with lukewarm water. Alternatively, consider covering the puncture site with a warm, moist towel or other warming device at a temperature of 42 degrees centigrade, 107 degrees Fahrenheit or less. Be careful to avoid burning the patient. Disinfect the sampling site using the method recommended by your local guidelines. Allow the area to air dry. If you're using alcohol to disinfect, make sure the alcohol has fully air dried before performing the procedure, as alcohol can cause inaccurate results by hemolyzing the specimen. Press the safety lancet against the sample site. There are many types of safety lancets available. Some activate when pressure is applied to the sampling site, and others are activated with a button or trigger. Regardless of the activation method, all safety lancets are designed to pierce the skin swiftly and automatically retract into the unit to prevent reuse or needle stick injury. Once used, dispose of the safety lancet in a biohazard sharps container. The color of the sharps container will depend on your local region's guidelines. The used device must not be disposed of in regular waste containers. After you have made the incision, wipe away the first drop of blood with a clean gauze pad. This will help to avoid specimen dilution with interstitial fluid, which can lead to inaccurate test results. Some tests do not require this step, so check your institution's guidelines for the specific test for which the sample is being collected. Make sure the finger is positioned downwards so that gravity can assist with blood flow. Hold the finger firmly near the base and gently massage along the length of the finger towards the tip, using a gentle squeeze and release technique. This will give the capillary time to refill and facilitate a constant and steady flow of blood. Be careful not to squeeze too hard, as excessive squeezing can cause problems, for example, hemolysis, dilution of the specimen, and obstruction of blood flow. Depending on the test you are conducting, you could use a number of methods to collect the blood sample. If you are using a capillary tube or pipette, hold the device at a 90-degree angle in a horizontal position and touch the end of the tube or pipette to the drop of blood. Avoid touching the patient's skin with the capillary tube or pipette, as this could introduce skin cells into the sample. It is also important not to use a scraping or scooping motion, as this could cause hemolysis or specimen dilution and lead to inaccurate test results. Alternatively, you may need to collect the sample in a specially designed collection tube by allowing blood droplets to drip and flow into the tube by natural capillary action. It is also important not to use a scraping or scooping motion here. Collection tubes contain certain additives specific to the test or tests for which they are designed. You will need to ensure that the collection tube is filled to the right level to enable a mix of blood and additive. Under or overfilling the tube can also lead to inaccurate test results. It is important to gently mix the blood and the additive well. To aid this process, it may be helpful to gently rotate or swirl the tube after each drop of blood is collected. Once you have collected the necessary amount of blood, you should carefully invert the tube 5 to 10 times to ensure that specimen and additive are well combined. Do not shake the tube, as this causes hemolysis. Failure to mix well immediately after collection or under or overfilling the tube can lead to specimen rejection and test result errors. Refer to your institutional guidelines for the test you are conducting for information on storage time and temperature of the capillary collection container. The general recommendation is to analyze the capillary collection container promptly. Sample with confidence with the Uni-Stick range of single-use safety lancets and sample right first time.